Well, hello and welcome to the Mindset Mentor. I'm your host, Tania Kolar, helping you cultivate your best life. And you always hear me talk about how your mindset is truly like a muscle that needs to be strengthened and conditioned. And boy, have we ever got a great mindset workout for you today. We are going to talk about functional medicine and brain regeneration. And it's so interesting to hear the link of sugar in all of that, and actually so much more. So I've brought the expert on to share. He is the author of a book called Blood Sugar Doesn't Lie. Or, yeah, that's kind of cool, isn't it? So it's the truth. And sugar, it's just crazy what the sugar does to the body. So we're going to learn all about the truths of that in this hour with Dr. Ben Galyardt. Dr. Ben, it is such a pleasure having you on the Mindset Mentor today. I've been really looking forward to delving into this conversation with you because I think the world needs knowledge, more knowledge about what sugar and other foods and environment does to the body and to the brain.
Absolutely. Especially when we're talking about the brain, it's such amazing organ. It does more than any supercomputer ever could imagine, and Elon Musk can't even, devise something like that. But it also is very, very sensitive, and it's very fragile. And
Hmm.
go ask somebody that's had a concussion. Go ask a NFL football player or a NHL hockey player. That they know how fragile their brain is. And so I wrote a book also on brain, and it's Rebuild Your Brain, and it's called Stop the Damage, Start the Repair. And that's really the thought process of anything. So many people are like, ooh, take lion's mane, right? Take this mushroom, take this magic, whatever. But if you're still damaging and trying to build up, you're only going to get so far. You've got to stop the damage, but also start that building up. So yeah, and it's the same thought process with whether it's your thyroid or your gut or any other system. You've got to really stop damaging that, but also build it up as well.
Yeah, I love that. And, I can't wait to read, your second book as well. Now, that's really interesting because, so many people are experiencing damage and that manifests in disease in the body. But how do we really know that there's damage and that we need to start paying attention? Because I think the body's a really good indicator of telling us
Yeah,
what's going on, right?
Yeah, absolutely. And there's some different ways. A lot of you guys, you can tell. You're like, man, I got brain fog. I'm tired. I can't lose this 30 pounds or, you're 15 kilos, well, however much you're wanting to lose. Or you're just, man, I'm just not functioning at my highest level, or I've got this weird skin reaction going on, or, my breath is really smelly and I've got gas and bloating, or whatever it is. A lot of things you can tell something's not right just by symptoms, but then
Mm.
that's harder to diagnose. We actually can tell a lot from symptoms. And when we have a patient sit down and do a questionnaire, it's like an hour and a half, and it's all
Wow.
these things like, do you get dizzy when you stand up? Do you have a problem remembering spatial things, like where you put your keys, and all these different things are pointing towards different systems. So that's one part of it. And so you probably know, the listener knows if you've got some issues going on out there. We may try to just hide it and not think about it and hope that it goes away.
Yeah.
But then we also have blood work to be able to look at that. And that's a foundational piece in the functional medicine model, is to look at the blood work and figure out which systems are out of balance. And that's the whole thought when we think about functional medicine, and how I've been doing this for over 20 years, and how the thought of, okay, it's got to be the systems that we're treating, not the symptoms. And so many people get hooked on treating symptoms. I've got reflux. Better take something for reflux. I've got a sleep issue. Better take something for sleep. I've got toenail fungus. Better take something for toenail fungus. Instead of, why do you have reflux in the first place? And that is a systems based approach. And so that's what you've got to do then. Then you look at the blood work and you go, okay, which of these systems are out of balance? Is it the adrenals? Is it the thyroid? Is it the blood sugar? All of those different ones. Then you just move your feet and start fixing each and every one of those systems.
That's really interesting. So if we were to come and have an assessment, and you're based out of Colorado, the Fate Wellness Center, let's say for example, and I know you've also created a particular method, and we can get into specifics of what that method looks like and what it's called. But I really, when we come and have the blood work done, then, what can it tell us? So if in terms of, where we're at and where we need to be.
Yeah, absolutely. And this is the fun part about functional medicine. How many of you guys out there have heard your doctor say, "Oh, everything looks fine in your blood work,"
Mm-hmm.
or it's all in your head. That's why you're tired or you're depressed, or here, let's give you an antidepressant. So many patients come in and they've been put on psych meds because the doctor doesn't have the tools to dig deep enough into figuring out what is going on. And so in the functional medicine world, it's more about a functional diagnosis. So in the traditional medical model, it's all about diagnosis, right?
Mm-hmm.
We've got our ICD-10 codes, and you go, okay, well, we're going to diagnose you with X, Y, or Z, and then we can treat it with this medication, with this surgery, with whatever it is, and we treat that diagnosis. So that's just a traditional diagnosis. In the functional world, the functional diagnosis is you're hypoglycemic. So your blood sugar is averaging low. What that does physiologically is the important part. Not that, okay, great. So you're hypoglycemic. Have you heard that term before?
Yep.
Yeah, so low blood sugar, hangry, spacey, cranky, all those things when, the busy moms out there that are, giving their kids meals but forgetting for themselves, whatever it is. And so we've got this diagnosis. Okay, you're going into a hypoglycemic events quite regularly, but then you have to look at physiologically, what is that actually doing and what is causing that? So physiologically, from a hypoglycemia, we know that the adrenals are going to be stimulated every time the blood sugar goes too low to tell the liver, which stores glucose, to kick out sugar.
Mm.
So every time you go hypoglycemic, you're not only needing sugar, and thankfully we store it and we kick it out, but you're also driving this adrenaline response. So many women I see have what's called random anxiety. And so then they go, "Oh, well, you need to go on Xanax, or let's give you an anti-anxiety medication." It's a psych issue. It's actually an adrenaline spike because of that blood sugar crashing down because they ate something that made that blood sugar spike up and the body overcompensated, pulled it down, and then we get this adrenaline rush. And now you're waking up in the middle of the night, drenched, sweating in your bed. I have some women, they put a towel down before they go to bed, and they're like, "Oh, it must be hot flashes." I'm like, "You're 34. I don't think you're going through menopause yet."
Wow, that's so interesting because I know so many women who, are experiencing that. And personally, for myself, I've sort of, come to that stage where I'm having these, hot issues. Call them whatever they are. I don't know what they are, but I never had that. But what's really interesting that just sort of piqued my interest immediately is that you said that there's this random anxiety. Now, I've never been an anxious person, but I sometimes find myself feeling anxious, and I'm like, where is this coming from? And also, with these hot flashes at night, or again, whatever you want to call them, the sweating. Never had these issues, but I also thought that it was related to medication because I've recently gone through some health experiences, going through breast cancer, and
Yeah,
I just thought it was kind of like a residual of that body trying to get rid of something.
sure.
But if we can, get control of the glucose levels, can that help to level off some of these issues and the symptoms that people are experiencing, whether they're caused through medication or diet?
Absolutely. So,
Mm.
a couple examples here. I've had teenage girls that when we put a continuous glucose monitor on them, that's
Mm-hmm.
a patch that goes on the back of the arm. It's if you know somebody with type 1 diabetes, that's what they use and then get their insulin injection based off of that. And that continuous glucose monitor, these teenage girls would be sitting in their classroom at school and freaking out, texting mom, "I got to go home. I can't handle this." And they check their blood sugar. It would be in their 30s and 40s.
Ooh,
I don't like
high.
it under 85.
Oh,
I like it
under.
85 to 1.
That's low. I was thinking that's high, but I'm thinking of the opposite.
Yes,
Insulin.
yes.
Yeah, yeah,
So
yeah,
in the U.S., I know in U.S. and Canada, there's a little
yeah,
difference in how they read the A1C and blood sugar. But
yeah.
in the States, 85 to 110 is how I like the blood sugar, and they're sitting in the 30s and 40s, like half of where they're supposed to be. I'd be curled up
Oh,
in the corner, passed out without enough sugar, and they're
oh.
sitting there freaking out because they just had this adrenaline dump. And now they're feeling so anxious, and their doctor just wants to put them on meds and go, oh, they're just a stressed out kid, just get hooked on all these psych meds.
Wow. So how do we get rid of that adrenaline spike?
Yeah.
How do we do that?
So here's what I've said for a long time is that if we could stabilize everybody's blood sugar 85 to 110
Hmm.
all day, every day, morning, night, before meals, after meals, everything, we could reverse or prevent upwards of 90% of chronic health conditions.
Whoa.
Even your cancer there.
Yeah.
Cancer is a metabolic condition. For
Yeah.
years, they thought, and there's a few types of breast cancer, a few things that are genetic,
Yeah.
but even still, just because somebody has a breast cancer gene doesn't mean they have to get breast cancer. It has to express itself. And a lot of researchers have actually given up on cancer research because they were looking for that one gene, that one little fix, and could never find it. What they found is that it's a metabolic disease, and cancer actually feeds on sugar.
Yeah.
And,
Yeah.
and it's crucial to get that stabilized as much as possible. Autoimmune conditions, MS, lupus, rheumatoid arthritis, celiac, Crohn's, all these things, we know that every time that blood sugar spikes up, every time that blood sugar goes down, drops down, they're going to rev up their immune system and destroy more tissue. So
Wow.
this is that foundational piece of, okay, we've got to get this stabilized, start there, and then we can go into these other systems.
Yeah, I find that fascinating, and I would say from my experience as well. Oh yeah, I was definitely overdoing it with sugar. I know that it was just that, hey, feel good, quick pick me up, just go for the sugar. And
Yep.
I also kind of, intuitively feel that the cancer was really old. It was there, it was ready. My body was ready to purge it, right? So it was kind of like
Yep.
a good thing. It was just I'm in a clearing
Sure.
phase, right? And so, but I also believe that it was tied to, past trauma stored in the body, right? Which I think that so many people are experiencing that, needing to release that. So, what is your thought in terms of the correlation, health and, emotion, trauma, all that kind of thing trapped in the body?
Yeah, absolutely. Unfortunately, it's way more prevalent in women than men. I mean, if you had a group of 100 women and said who's had sexual trauma, who's had some physical trauma, things like that, it would be
Mm.
unfortunately a very high percentage of women would raise their hand. And so you add that to then having a career, getting married, and having to deal with husbands and then you've got kids, and then you've got the stresses of the diet, and even this, every time a female leaves her bathroom in the morning, the average female has been exposed to over 160 chemicals that her
Mm.
body needs to detoxify from makeup and hair and all of these different things. And it's just this huge load on the body, and that emotional side is just one more thing that needs to be processed through. And unfortunately, I think in today's day and age, with social media, with we feel we're so connected with everything going on, but we're actually more disconnected than ever. And to have true relationships, to have true connection, and be able to work through things and to heal is actually a lot more challenging in today's day and age than it was, when we grew up. There was, what did we have for internet? There wasn't even such a thing. So
Exactly. There were no cell phones, right? Like,
yeah,
so it was a completely different world, and I do find that so many people are inundated with stress, the daily stressors of just living. And so I think it really is important to sort of check in and take stock and say, well, wait a minute, what am I doing proactively for my health? What am I doing proactively for self-care? Because it can be last on the list of, who comes first. And I think it's important to really do what we can to feel our best, because we want to live our most magnificent life, and it's really hard to do that if you're not physically or cognitively feeling optimal. So we're going to continue continue the conversation here on Sauga 960 with Dr. Ben Galyardt, and he is a functional medicine doctor. Also, he is the CEO and founder of Fate Wellness Center and the Galyardt method. So we're going to jump into that conversation when we come back. Stay tuned, and we'll be back here on Sauga 960. Welcome back to the Mindset Mentor. I hope you're having an absolutely phenomenal day. And how are you feeling? Did you wake up excited, jumping out of bed with energy, or did you wake up exhausted, feeling like, oh my goodness, how am I going to get through this day? Well, and unfortunately, so many people are sort of struggling because they're not feeling physically or mentally well. And we're going to talk to our expert, Dr. Ben Galyardt, today, who is a functional medicine doctor. He also is the CEO and founder of the Fate Wellness Center in Colorado, who is helping patients really optimize their health. In fact, literally regenerating their brain. And, you know, it's a fascinating topic. We're going to continue the conversation. Dr. Ben, you have sort of focused your career on a personal experience, having witnessed your mother going through some medical challenges quite some time back, and to be able to see the progress that she made. So let's talk a little bit about. I'd love to talk about that story if you'd like to share that, because I think people listening and who listened to us just a moment ago were thinking, hey, that sounds really great. I want the help, but how? How is there hope for me? I mean, I think people have become a little bit hopeless, and a feeling of hopelessness causes depression and causes more disease. So how do we prevent that? So please help.
When I started thinking about where the body can go and how it can heal and what's actually possible, I go back to when I was in high school and my mom collapsed. I was playing football and she collapsed at the game, and a bunch of people came up afterwards like, oh my gosh, did you see what happened? They had to carry her out to the car and get her home that way. And I didn't see her at all. And so I got home, I was like, oh my gosh, what's going on? And so they went down this path of going to doctors, neurologists, endocrinologists, all these people. And finally they said, oh, you have MS, multiple sclerosis. And MS traditionally is this degenerative condition that people end up dying from or being wheelchair bound, things like that. And it was a pretty big blow. My mom, she was a school teacher of the year, would leave at 5:30 in the morning, get home at 5:39, then grade papers every night. And I think that's part of why she got autoimmune, and her body just kind of went, I can't do this anymore. And so she went down the path of, okay, the neurologist says, get on this drug. So she got on these drugs, go see this physical therapist, do some therapy, and it's probably going to have a flare up, and then you're going to get worse, and then it'll stop, and then you'll flare up and get worse. And it's this degenerative condition, and that's kind of it. And they were actually a few years away from retirement. And it's like, wow, that changes a lot of things. And so my dad, he ended up retiring a couple of years later. And my mom, she had a cane. She would use a wheelchair when she needed to. At Walmart, she'd go around in the little scooter because she couldn't walk around the store. And it was just this downward spiral that we thought, man, is that going to be it? Fortunately, she moved down to Missouri. And in this small town of like 10,000 people, there was a doctor that was doing basically functional medicine before it was even called functional medicine. And he was able to start with this same systems-based approach of, hey, let's work on your gut, let's work on your brain, and let's work on, that mindset was a big part of it, because, she was the oldest of 6 girls and perfectionist, and everything has to just be so right. And that ultimately, that stress and everything caused her body to start attacking its own tissue. And MS, multiple sclerosis, is brain and spinal cord plaquing, meaning we're destroying that nerve tissue. And fortunately, her body had that healing potential inside of it, because she went through the process of this healing, went through, okay, good. Now I stopped destroying tissue. That's great. Well, guess what else can happen? The body can actually heal then. And her body started healing these damaged areas and healing these plaques. To the last MRI she had, the neurologist said, oh my gosh, if you were on all the drugs, we'd call it a success, but you're not. So I don't know, we'll just call it a miracle. And
wow.
She actually reversed her MS. Last Friday, she turned 80 years old, and she does granny boot camp. She takes my kids fishing. My 13-year-old was just down there for spring break fishing every every day with grandma and grandpa. And,
Oh.
she doesn't have MS anymore. And that was like, okay, if somebody can heal from MS, what else can we heal from? Can we heal from thyroid issues? Can we heal from gut issues? And so we've been able to reproduce this healing process in people's bodies because we have this innate intelligence where the body knows what to do and it knows how to heal. And if you get this big injury, the body's like, hey, let's fix this. If you give it enough of the good stuff and take out enough of the bad stuff. And it's kind of oversimplification, but that's really what it is. Give the body the chance to heal, and it's got that potential inside of it.
Yeah. Oh my gosh. I love that story. And thank you for sharing that and the experience, that your mother has gone through and what you witnessed as well. And it's kind of scary, right? When you think that, at one point you've got this diagnosis that's degenerative and then, seeing that decline. But what a remarkable story. And that now your mother, who was once, walking with a cane, in the wheelchair, scooters, now is out there hiking and fishing, enjoying, having the full mobility and the reversal of disease. That's a huge one right there. And that offers so much hope to people. Anybody listening out there right now, there is always hope. I never want you to give up. Keep that mindset strong and know that the body does have that innate intelligence and ability to heal. And if Dr. Ben's mom can do it, you can do it as well. And that's the thing, I think, Dr. Ben, is that some people think that, well, that sounds great, but miracles don't happen, for me, or it's not possible for me because it's, maybe family history of whatever disease, right? But it's always available if we feed the body the right things, if we feed the mind the right things, if we stay away from all of the damage that causes inflammation. So what are some of the things that we can do proactively on a day-to-day basis to, reverse some of the damage that we're experiencing?
Yeah, well, I'd like to start out with kind of my thought process of what I do for my body.
Mm,
I've got a couple things going for me. I've got an APOE4 gene, which makes me, it's called the Alzheimer's gene, and I'm 4 times as likely to get Alzheimer's.
mm.
And then I've had multiple concussions, so now I'm 10 times as likely to get
Ooh.
Alzheimer's.
Mm.
And I don't want my kids locking me in the basement when I'm older or wiping my butt or whatever. I want that brain to rebuild and repair as much as possible. So, just some thoughts that I have throughout the day. One of the ones when you're talking about mindset, I always think about it that either creates your day or your day creates you. And part of that is just getting up in that right space, like you were saying. Are you getting up and saying, "Good God, it's morning," or "Good morning, God"? I love that thought of like,
Yeah.
man, let's go, or holy cow, I can't even do this, and I just need my coffee, and I got to stumble through the day, and then I start doom scrolling and whatever else is going on. So setting that intention and setting that time each morning, whether that's an exercise piece, a prayer piece, a thought of reading and spiritual text, whatever you want to do, but to get your mind in that right place. Because if you just kind of stumble into the day, that's what you're going to get out of the day as well. So, mindset, that first part
Mm-hmm.
is crucial. Another piece that a lot of people nowadays have gone the other way, and they used to skip breakfast, and now it's called intermittent fasting. So now they're like, "Oh, I intermittent fast, I'm healthy," and it's like, no, just because you skip breakfast doesn't mean you're doing something constructive.
Mm.
And break fast, it's there for a reason. Breakfast is a very important meal, and intermittent fasting, not necessarily bad, but most people are doing it backwards. You need to be finishing by like 5 o'clock at night and then fasting until 7, 8, whatever in the morning. And then you eat for that period of time. But
Mm.
just like we were talking about earlier with the blood sugar and the adrenals and that hypoglycemia and all those things. So if somebody just wakes up and like, I don't really feel like eating, and skip that breakfast and then push it till lunch, they're stressing out their adrenals even more. Their adrenals are the stress glands. Jobs and cars and kids and COVID and presidents and gas
Mm-hmm.
prices and all these different things. We're all already stressed out to the max. And so then we do it even more with that food. So actually having a good quality breakfast, some protein, some good
Mm.
vegetables in there. So whether that's eggs or ground meat and a bunch of vegetables and some good fat, and really get that blood sugar stabilized. So that good blood sugar throughout the day is going to be crucial. That's going to keep your brain as balanced and the brain fog away. And then doing at least an annual blood work where you're just aware of what's out of balance and looking at it not
Mm.
just from most of the doctors in the US will go, oh, your cholesterol's high. Okay, well that's bad. Otherwise everything else is okay. But looking at that whole blood work as far as, okay, why do you have a low ferritin? Ferritin is your iron, and so many women have low ferritin. But
Mm.
why? Why is that actually happening? And what does low vitamin D contribute to the body? And in Toronto, you're probably not going to be out in your bikini between 11 and 1 every day.
Yeah, exactly. Definitely lack of sunshine. And also that affects the mood. So, all of these things play a huge contributing factor for sure.
Yeah, yeah, absolutely. And so, it's really about evaluating each and every one of the areas of our life, whether that's the mindset, whether that's what we're putting in our mouth, what we're
Mm.
drinking or eating, what you're thinking, and just the information that you're bringing into your mind. Focus on the positive things and focus on the good stuff. If you're watching news, guess what the news wants your mindset to be?
Yeah, fear based. Exactly. Yeah.
Fear-based.
Yeah. And, remember that, whatever we focus on, expands. So it's important, especially as you're going to sleep, where your mind is a little more malleable, the subconscious mind. You don't want to have all of the trauma from the day playing over and over through your mind as you're sleeping. No wonder you wake up feeling exhausted, mentally exhausted, even
Yeah.
though you may have had, X amount of hours of sleep, you feel exhausted because the mind is overworked. So, sleep, I think, is a huge contributing factor to some of, the disease that happens. It's the lack of sleep because the body, of course, is healing and rejuvenating as we're sleeping, and we're not building that immune system. We're not getting that sleep, and I think that affects so many different things in our lives. You talked about intermittent fasting, which definitely has been a huge craze. Some people are seeing great results from intermittent fasting, but it's important to know the right way to do it. Now, I'd love your thoughts on so somebody is right now doing that morning intermittent fast and they skip sort of a meal. Can they add something like MCT oil so that they're feeding the brain while they're on that, so to speak, intermittent fast? Because we still need the nutrients, right, in order to function
Yeah,
optimally, cognitively, for
absolutely.
sure.
Yeah, so a couple things there. So if somebody is doing intermittent fasting, you need to know your personal physiology. Is
Mm.
all intermittent fasting good or bad, or is morning or night better? Well, it's individualized.
Mm.
Just like when we're checking blood sugar, some people, sweet potato is worse than white potato for your blood sugar, even though we're told something totally differently. So
Mm.
intermittent fasting, a couple tips for this if you guys are doing that out there. And a lot of people have lost weight, different things, but you have to evaluate your adrenals. Two things to look for in the blood work are cortisol and DHEA. Those are our two main adrenal hormones, and they could either be high or low. Either way, it's going to be telling us that the adrenals are already stressed out more, and that actual intermittent fasting may not be constructive. And that's the fun part about using a continuous glucose monitor, is you get to see 24/7 what that blood sugar is doing. And if you're down in like the
Mm.
70s and your body's trying to get that blood sugar up, you are stressing the adrenals as you do that. So one thing that you need to be doing if you're finding success with intermittent fasting and doing well with that, to have long-term health and get enough nutrients, you need to eat like a king in that 6 or 8 hours,
Hmm.
or queen. You need to eat and get your 1,600, 1,500, 1,800 calories in that amount of time. What a lot of people do is they'll have their lunch and they'll have their dinner and they end up with like 800 calories, and they're actually in calorie deprivation, which long term has a lot of negative effects on the body.
Thank you for clarifying that because I think that's a really big one right now. And of course, everybody, is keen to try things, to whether they want to lose weight or they just want, optimal health. So it's really good to sort of know that. And really fascinating about the glucose monitor. Do you suggest, like, who do you suggest tries that, and
Yeah.
how do we do it?
Yeah, absolutely. So I'm located in Colorado. We have a brick and
Mm-hmm.
mortar office in Tennessee as well,
Mm-hmm.
and then we work remotely with patients all over the U.S. in Canada. We just got our approval to be able to get our continuous glucose monitors delivered to Canadian patients as well, which is super exciting. So in my book, Blood Sugar Doesn't Lie, I explain in detail how to do
Mm.
a finger prick glucose monitoring. So that's what we did for years before we had access to the CGM. And
Yeah.
so you poke your finger 45 to 60 minutes after a meal, and you just record what that is, if it's higher or lower than what we want it to be. And then throughout the day, maybe four, five, six times a day, you're going to be checking your blood sugar. Oh, you're having random anxiety. Poke your finger and see what that blood sugar is doing. And so some people are like, I'm not going to poke my finger. And other people are like, oh my gosh, this is so cool. And they do it. And that's like a $40 solution. The continuous glucose monitor, it's a little bit more than that, but you get this patch, it Bluetooths to your watch, to your phone, and it
Mm-hmm.
tells you 24/7 what your blood sugar is doing all night long. So you can see when you wake up and you're like sweating and you're like, holy cow, I'm having this episode, whatever it is it blood sugar related? Well, oh, wow, I went down to 65, and that's what it is. I've got a patient. He works in corporate America, pretty high up in a well-known health food chain in the U.S. and he was having heart. He thought it was post-COVID. He was having this heart pressure, this racing heart, this kind of almost pass out type sensation,
Oh, wow.
and it sounded like a post-COVID kind of almost a POTS.
Mm.
I don't know if you've heard of that, where people's heart rate spikes up because that blood pressure crashes down. And what he found once he got that CGM on was as soon as he started feeling that, he looked at the blood sugar and it was when it had crashed down, and it was this hypoglycemic event,
Hmm.
and secondary to actually having this spike. And so we're up and down, up and down.
So what causes that up and down? Like, so you're having foods,
So
ingesting foods,
yeah,
or yeah.
so two things. One is going to be the natural response to having carrot cake. So you eat carrot cake and that blood sugar goes up to 160, and the body says, oh crap, my brain, we're talking about preserving the brain, my brain
Mm.
does not do well on lots of glucose. It actually
Mm.
causes neurodegeneration. They call Alzheimer's type 3 diabetes.
Oh, wow.
It is such a connection between high blood sugar, high insulin, and your brain degeneration. So the body's like, oh crap, bring it down. How far down? I don't care. Just get it down. So it kicks out a whole bunch of insulin. The insulin grabs the glucose and drives that sugar down. And a lot of times we overcompensate and it overshoots. And then we get this hypoglycemic event. And then we're tired and spacey and hangry and not thinking right. And then what do? Well, we go and grab some pretzels or get, whatever you used to feed yourself on and run on sugar
Yeah.
in those low times. So that's one possibility, is the spike and the crash. The other is you go, okay, well, I had some chicken and broccoli and that I didn't spike, but that should be enough. But maybe or you just had some stir fried veggies and some rice or something like that, and that blood sugar does this and then starts doing that. So you need to learn individually what sustains your blood sugar. And for
Mm.
a lot of people, that's enough good fat. So, like you were talking about, MCT oil,
Mm.
grass fed butter, coconut oil, olive oil, avocado oil, avocados,
Yep.
things like that. You add enough of that. I always think if I'm perusing the kitchen after I had a meal, like within half hour to an hour, and like, ooh, I want a little, treat or whatever, I probably didn't have enough fat in that meal.
Oh, interesting. Okay. Well, that's good. That's a good indicator because it gives us an opportunity to course correct at that
Yeah,
point, right? So we have a choice. Maybe
absolutely.
have a little bit more something, that's going to sate
Yeah.
us in a healthier way versus, reaching for those unhealthier foods. So,
Yep.
does the same sort of go for processed foods? Because there's a lot of like sugar and just garbage essentially in processed foods. Does that also do kind of the same thing?
Yeah, and those will all contribute to that spike.
Mm-hmm.
If you're eating, and interesting, even like some of the artificial sweeteners can still create this insulin spike because the body's perceiving that sweetness, and it's like, oh boy, we gotta pull it down. So even if you're having some Diet Coke or any type of aspartame, anything like that, you still can be having swings, even though it's sugar free.
Oh, interesting. I'm loving the conversation with Dr. Ben Galyardt. He is a functional medicine doctor, and we're actually going to talk about the Galyardt method when we come back, helping us to optimize our body and mind. Stay tuned, and we'll be back after this on Sauga 960. You're listening to The Mindset Mentor. Welcome back to the Mindset Mentor. I'm Tania Kolar. We're having an awesome conversation with Dr. Ben Galyardt. Dr. Ben is the founder and CEO of the F8 Well Centers, or also known as Fate Well Centers. Dr. Ben, I think I said earlier it was, the Fate Wellness Center. So clearly I got to work a little bit on my well-being, right? I guess I didn't get enough sleep last night.
Oh, come on.
So, it's so great to have this conversation with you. And you have developed a method to really help, patients and everyone to have optimal health, not only physically, but, brain health, which is actually known to regenerate the brain, which is fascinating. So, I'd love for you to share your method that you've created.
Yeah, absolutely. And when you start thinking about health, just like you talk about every day, you've got your mental and your motivation and your drive and all those things, and the brain is a huge part of that, but it's also a huge part of keeping us out of that adrenaline dump phase. It's also a huge part of just giving us each and every one of our systems the ability to function as optimal as possible. And so the brain has always been a huge part of what we look at. We do in our Tennessee and Colorado offices, we do what's called a brain map and then neurofeedback. But we're actually able to now do neurofeedback in a remote setting. We have home units that patients are able to do, and that basically is training the brainwave patterns, just like you were talking about sleep state. So many of our patients are anxious, they have poor sleep, they have ADD, all of these brain issues. And if all we had was just dietary changes and supplementation to help these people, it would be very, very challenging. So what we've found is that you can actually train the brainwave patterns. And if that brainwave pattern is going too high, too fast in the middle of the night, you could sleep 6, 8, 10, 12 hours, and it doesn't matter. You're not going to wake up refreshed. And
Mm.
so that's that good God, it's morning phase there. And it's going to be this, man, I'm just depleted because you did not repair. And that repair, bone, skin, hair, nails, joints, brain, all of your intestines, all of these different things repair when you're getting that good quality sleep. So for us, evaluating the brain and doing brain support is absolutely crucial if that's part of it. The other side is, like we've been talking about, this systems-based approach. We've got to look at each individual system and go, what's the blood sugar doing? What are the adrenals doing? What's the thyroid doing? What's the inflammatory markers and the liver and all these different systems? And then we combine all that together with the brain, with using the continuous glucose monitor. Every one of our new patients gets one, and we just start moving our feet. And it's a systems-based approach, and you go step by step by step. And here's the fun part. Hashimoto's, which is autoimmune thyroid, and lots of women have it.
Hmm.
We might have 10 Hashimoto's patients that are experiencing that, and yet with Hashimoto's, they might have each one of them totally different systems out of balance. So we're not treating the Hashimoto's, we're treating that individual with these 4 systems out of balance, and that next person has these 6 systems out of balance, and this next one has 8 systems out of balance, and we just go through and fix what we find. And that's what over 20 years of experience has done, and a lot of successes and a lot of trials, and it just, each patient that we see, it's just, okay, we improve a little bit more, on how we're able to help people.
I love it. So I'd love to learn a little bit more about some of the experience that you've had with your patients. You spoke earlier, about your mom's experience with MS and the miraculous, healing of reversing MS, that she's experienced, which is amazing. But let's give the listeners some context so they can understand that, because I love the fact that what you're doing is so personal and customized, because everybody is different. And that's one of the things for me in my journey with breast cancer, is I felt that the treatment was so, here's one treatment for everyone, right? Here, oh, you tick off these few boxes. Well, here's your, solution. And I personally chose a hybrid approach. So I did, work with a nutritional therapist and supplementation to really augment, the treatment. So what examples can you share with us?
Yeah, so here's something that we see all the time is that like this patient, she's in her mid 50s, and 20 years ago she got diagnosed with hypothyroid, low thyroid,
Mm-hmm.
and they actually did the Hashimoto's test to see that it was autoimmune, meaning the body is attacking the thyroid. They put her on levothyroxine, that's the number one best-selling drug in the United States, the T4 thyroid, and they said, okay, good luck. Now you're going to be fine. So that was probably necessary. She was hypothyroid, so they
Mm-hmm.
gave her T4 over here. But over here was an autoimmune disease. And that was the Hashimoto's. The T4 does nothing to fix the autoimmune. That'd be like if my mom went in and she had MS and the doctor said, okay, you have MS, we're going to give you T4. We're going to give you thyroid hormone. You'd be like, that's
Oh.
silly.
Mm.
So nothing was done for this autoimmune condition. So she, fast forward 20 years, she comes in and she's got this itching skin, and anytime like she does down dog or any movement, it's just super tight and rough and like won't even stretch, which, obviously some type of autoimmune. We don't even know what it was at the time. We ran blood work. She was having joint pain, and she also showed up with rheumatoid arthritis, which is another autoimmune to the joints. And so here's where traditional medicine failed her, was they said, okay, that's fine. You have an autoimmune disease. We're not going to do anything for that. We're just going to give you T4 thyroid hormone and hope that you've got enough thyroid hormone and you're not tired and you're not crying at commercials and your hair's not falling out and
Mm.
all those thyroid things. But they missed the whole moral of the story, which was your body is attacking its own tissue. And so within 2 to 3 weeks of starting care with us, stabilizing blood sugar, starting to work on the gut, doing these things, the skin sensation, we're now 3 months in and it's totally gone. Her joint pain is gone. And she was saying she feels like she's 30 years old last week when I saw her. And this is what we get to see, is that, oh my gosh, instead of having to go on prednisone or methotrexate, which is low dose chemo, or Humira, which is $10,000 a month, all these autoimmune drugs,
Mm.
it's like, hey, let's just give the body what it needs, take out the bad stuff, and get to see these true changes.
Yeah.
So that's the fun part about this, is to really take somebody, meet them where they are, and just go, okay, let's work on your body, let's work on you, and give you the tools to long term be able to make these massive changes.
Yeah, I love that sort of feedback, right? So that, somebody knows exactly, that where they are, and it's kind of like giving them the GPS, the direction of, let's get here, right? And you can get there, right? It's just a matter of taking action, but having the knowledge. So the knowledge is key. So can you let the listeners know how they can find more information about the work that
Yeah.
you do and your books?
Absolutely. So I have 2 books, Rebuild Your Brain, Stop the Damage, Start the Repair, and
Mm.
Blood Sugar Doesn't Lie. You can get those on Amazon and all the book outlets out there. And then we have, our website is F8, just like here, F8wellcenters.com. And that has all of our information. We're on TikTok. We've got over 220,000 followers on there, about 110,000 on Facebook, Instagram page, YouTube channel. We've got over 800 shared videos in all types of educational format there for autoimmune, for leaky gut, for any type of brain issues, tons and tons of information out there. So both my parents were teachers, and I think it's just kind of part of my nature is that I need to get the word out and help people.
Educating the masses. I
Yep.
love it. I love it. Yeah, that's awesome. And I can't wait to get your books as well. So I will be heading to Amazon.com to check that out. And I hope the listeners do as well, because, this is knowledge that literally can be life saving, right? So we want to take action and control to optimize our health, both physically and mentally and emotionally. It's so interesting that you talked earlier, Dr. Ben, about the plaque, on the brain and the spine. So we want to, either, prevent that or, reverse it.
Yeah, absolutely.
It's been a pleasure having you here on the Mindset Mentor. So I want to acknowledge you, Dr. Ben Galyardt, for the work that you're doing to educate and to heal the masses. Keep doing the incredible work at the F8 Well Centers, and I hope there's another book coming soon as well.
Yes, absolutely. Well, thank you so much for having me on. And everybody out there listening, I just encourage you, no matter where you are in your health journey, take action. There's always hope. There's always that next thing that you can do, and never give up.
Oh, I love that. Never give up. You heard it right here on the Mindset Mentor with Dr. Ben Galyardt. I'm Tania Kolar, helping you cultivate a life you love. Stay tuned, and we'll be back here on Sauga 960.